Your Excellency, Dr. William Samoei Ruto, CGH, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, Your Excellency, Honorable Professor Kindiki Kithure, Deputy President of the Republic of Kenya, Your Excellency Dr. Moses, Your Excellency Dr. Musalia Mudavadi, Cabinet Secretary, Prime Cabinet Secretary and Cabinet Secretary for Foreign Affairs, Your Excellency Dr. Moses Wetangula, Speaker of the National Assembly, All Excellency Governors, Cabinet Secretaries, PSs, Members of Parliament, development partners, ladies and gentlemen. Your Excellency, it's a great honor to join you at the Kenya Health Summit 2026 on behalf of the Council of Governors and the 47 county governments. I wish to appreciate the Ministry of Health for convening this important summit and for the continued engagement with county governments in advancing the health agenda of our country. The theme of the summit, Reform Delivered, Health as a Right, speaks directly to the responsibility we carry as leaders. Health is not simply a sector of government, it is a constitutional right and a fundamental determinant of social and economic well-being of our people. Your Excellency, we meet here more than 16 years since the promulgation of the Constitution of Kenya 2010, which fundamentally transformed our system of governance. Devolution has evolved from a constitutional aspiration into one of Kenya's most consequential governance reforms. Today, Your Excellency, our emphasis is that we can do so much for Kenyans in the health sector through coordinated intergovernmental implementation, functional service delivery, and measurable patient outcomes. And I want to confirm on behalf of the COG that we have actually achieved so much in the space of healthcare. We have achieved tremendous results over the past 4 years through your leadership, Your Excellency, and through the bottom-up economic transformation agenda, BETTER, which prioritized universal health coverage for all Kenyans. I wish to highlight, but just a few areas that demonstrate the progress we have made and equally the work that remains before us. In primary health care, over 107,800 community health promoters, CHPs, were deployed under a 50-50 shared financing model between the national and county governments. This has expanded health service availability at the primary level. Primary care networks, PCNs, have increased from 89 to 277. On health financing, Your Excellency, since the inception of the Social Health Authority, counties have cumulatively received 46 billion shillings, out of which 31.4 billion has been paid to hospitals through the Social Health Insurance Fund, SHIF, and 14.2 billion has been reimbursed to primary health care facilities. 98% of public facilities have been onboarded on the Social Health Authority share. Through collaboration between the two levels of government, 32.4 million people have been registered under the Social Health Insurance Fund, representing a significant increase from the 7 million people previously registered under NHIF. Counties have also strengthened emergency response with 304 of our ambulances out of the 06 that we run currently already integrated into the National Ambulance Dispatch System, improving referral linkages and timely response to patients requiring urgent and specialized care. Your Excellency, through your initiative under the National Equipment Service Program, NESP, the county governments have now specialized equipment at all levels. This has gone a long way in improving the capacity of counties to handle critical patients and other access to specialized care. We now have MRIs, ultrasounds, blood equipment, blood chemistry equipment, you name it, in the most peripheral of places, Your Excellency. Through the UHC reforms and digitization, the Digital Health Authority has been able to distribute 42,300 digital devices across level 2 to level 5 facilities, processing SHA claims in all 47 counties. These are but a few areas that the reforms in the healthcare sector have greatly improved. Your Excellency, this summit is about consolidating gains, celebrating what we have achieved, taking stock, and charting out the way forward on what else needs to be done. We acknowledge certain challenges, especially in workforce gaps and industrial relations, and together we will work to solve those. Your Excellency, as the Council of Governors and the 47 county governments, we reaffirm our commitment to working with the national government, development partners and the private sector, civil society, health workers and communities to consolidate the gains thus far and to address the gaps that remain, as I said. Let this summit mark a renewed phase of cooperative governance, shared accountability, and accelerated implementation. Let's build on what has worked, confront what has not, scale innovation emerging from both the national and counties, and ensure that our reforms are felt where it matters, as it's already happening. Together, let's deliver a resilient, equitable, responsive, people-centered health system where quality healthcare is not a privilege but a right for every Kenyan in every county and at every level of care. Your Excellency, I want to conclude by observing that I have had politicians out there saying that the first thing they will do if they get into office is to scrap SHA. Your Excellency, actually one politician said, on day one, I'll scrap SHA. To replace with what? Your Excellency, your administration is doing its best to fix everything. I think what we have failed to fix as a country is the toxicity of our politics. I want to confirm that hospitals in the most peripheral of places today receive funding directly from SHA. And in many cases, and I've said this before, the challenge we have as governors is to control what they do with that money so that they're not using it to just do more pavements and more innovations, but use it to things that can actually help patient care. This would not have been achievable without SHA, Your Excellency, and without all the policy changes. Your administration has thought through everything from financing to policies to digitization. And as a council, we appreciate the partnership that we have. Your Excellency, let me just take a minute to introduce the governors who are here. Excellency Governors, you may just stand where you are. I hope I can see you. Thank you very much. From the very end there, we have Professor Barchok, Governor Bomet. We have Governor Gladys Wanga, Governor Homa Bay, Gideon Mungaro, Excellency, Governor of Kilifi, Fatuma Achani, Governor of Kwale, Governor, I call him Kipiego Arabsang, Governor of Nandi. We have Governor Simba Arati. We have our Chair of Health, Governor Abdul Samad Sharif Nasir. And we have Governor Wesley Rotich, Governor of Elgeyo Marakwet. And we have Governor of Nairobi, our host. Your Excellency, I want to end by saying that we look forward to very engaging deliberations for the next 2 days to discuss where we are, to consolidate gains, to appreciate ourselves that actually we have achieved a lot. And for those saying that they will scrap SHA, it's akin to telling us that they will destroy the roads that have been tarmacked once they get into office. I end it there. Thank you, Your Excellency.